Doctors of Reddit, what was a 1 in a million case that you personally witnessed? Before we start, don't forget to subscribe to the channel so you don't miss the next videos. I wish you a pleasant viewing experience. Story 1. I'm a dentist, not a physician. I had an assistant years ago whose daughter kept breaking out in ulcers in her genital region. She was 3 at the time. Doctors kept accusing the mom of exposing her daughter to intimacy predators. Had CPS investigate multiple times. She would break down in tears at the office, completely exhausted and hopeless, thinking her daughter was going to be removed from her care. All she wanted was answers. She shared her doctor's findings with me. I told her the symptoms were congruent with Behçet's. She went back to her daughter's docs and asked them to eval for this. They refused, saying she was too young to exhibit symptoms of Behçet's. She finally found someone to listen to her, and boom, kid had it. One of the youngest cases of pediatric Behçet's. Answer. I was diagnosed with Behçet's a few years ago. All the doctors thought it was intimacy-transmitted herpes. I kept telling them this is not possible because at the time I was a virgin. Eventually, one rheumatologist looked at me and said, definitely something autoimmune. It was so relieving to hear someone finally say something else. It's also pretty rare in white people, I'm white, but more common in the Silk Road countries. They were also talking about using me as a case study. Story 2. Not a doctor, but a little while ago, I had been having pain that I couldn't pinpoint the origin of. It felt like really bad acid reflux and back pain, and it went around the whole torso in the diaphragm area. One day I was doing sit-ups, and I felt like there was a golf ball moving under my ribs, so I went to the doctor. She examined me and didn't find anything unusual, so she told me to see a physio since I only felt it during movement. The physio examined me and didn't find anything either, so instead of wasting the appointment, he had me lay on my stomach with a pillow under my stomach while he worked on my upper back. I put my hands under my stomach to keep them from hanging down, and when I was told to take a deep breath, I could feel a lump pushing down from under my ribs. I asked him to feel it, and he was stumped as to what it could be, so he sent me back to the doctor. Turns out I had so many gallstones that my gallbladder could be felt through the skin when I took a deep breath. I was sent to the hospital and had an operation on a Friday night. They counted 21 stones. Largest one measured 1.2 centimeters, and the gallbladder was stretched so thin and so swollen that it ruptured while they were trying to get it out. All of the doctors in the hospital asked to feel it prior to the surgery because no one had heard of it being possible to feel a gallbladder through the abdomen, so I guess it was kind of rare. And apparently I should have been in excruciating pain, but I was just taking ibuprofen and trying to do stretches for my back the whole time. Answer. My mother called us one day at an unearthly hour for her, 7 a.m. Apparently she had been in pain all night, so she waited for us to be up and about. We called her over. Husband is a doc. Her pain description was the same as yours, which was something I had as a 15-year-old as an allergy and inability to digest eggs. An ultrasound later, gallstones. Story 3. Patient, but I was 15 and a cheerleader, relevant, and I woke up feeling kind of off, but nothing terrible. Get through the day with mild random symptoms, like feeling slightly woozy, and a distinct, definitely not wanting to eat feeling, which was unusual, but welcome because I was always hungry. I didn't think much of it, even when my muscles, especially legs, started feeling stiff. All the more reason to work out, right? By the time after school practice rolls around, I have a little trouble breathing, but it's hot. And it's Florida, so whatever. I'm a flanker at this point, front forward guard, so nothing too strenuous, so I press on. During a kick drill, I get a headache. It's hot because Florida, so I dismiss it. Then I get a nose fountain. Not a simple bleed, but what felt like a fire hose of blood spraying out everywhere, and it would not stop. It also looks a little weird bright. After 15 minutes of ice packs and pressure and no end in sight, Coach calls an ambulance. At the hospital, they cauterize a blood vessel in my nose, which smells lovely, and do some tests. Turns out I have simultaneously the lowest iron and the highest copper numbers they've ever seen, and they are baffled. My mother arrives and gets accosted by questions around potential chemical exposure and environmental hazards. They admit me and start chelation therapy. Throw around a diagnosis of Wilson's disease, but it doesn't quite fit. Several doctors argue about this. They give me iron pills the size of Twinkies and put me on some IV vitamins. My poop is a very weird color. This concerns them. They keep me for weeks. My copper numbers dip post-chelation and then start climbing again. No one knows what to do. Some idiot recommends actual bloodletting, or just taking blood and hoping my system makes better blood to replace it, I guess. They try this. I feel like a science experiment. It doesn't help. Eventually, they release me from the hospital. My bright blue eyes have a copper halo now. I have to take so many iron pills. Infrequent visits to monitor my blood, with random chelation therapy and other treatments thrown in along the way. This continues for years, and I just kind of learned to live with it. I am on a special diet to limit copper intake, can't take multivitamins, but have to take a bunch of other supplements, and if I forget to take my iron pills, my symptoms get bad fast, and my case is written up in a few medical journals. Fast forward to just before I turned 28. Headaches and weird coughs, misdiagnosed as a sinus infection, migraines, eye strain, put on antibiotics, nasal spray, glasses I don't really need but wear anyway. Then a doctor find a weird lump in my neck, a thumb-sized tumor pressing on my carotid. Fast track to surgery because of the location. It's cancer. They remove my thyroid and underneath it find an extremely weird-looking parathyroid. It's huge and kind of green-colored. They remove that too, just to be safe. Because of my weird conditions, they keep me a few extra days to monitor me and consult with my primaries and results there. And my copper and iron levels normalize almost overnight. My iris rings fade and disappear completely. They cut my iron pills down, then eliminate them entirely. For the first time in a decade and a half, I feel normal. The weird muscle spasms are gone, as is the stiffness, frequent cramps, eye twitches, weird poop, constant low-grade nausea. Turns out a mutated parathyroid was responsible the whole time. Answer: foie bieux to the idiot who suggested bloodletting. That's an actual treatment used for high iron levels. In hemochromatosis, your body accumulates too much iron for it to handle. The easiest treatment is to just remove the blood, because it simultaneously removes some iron and forces your body to use more to make heme. I assume they were so confused and desperate, they decided, fudge it, let's do it. Shame it didn't help. But the logic wasn't unreasonable for such a novel condition. Story 4. Not a doctor, but PT was my dad. He had been having sinus infections that would not stay away for about 3 months. Sinus pressure headache, eye pain, runny nose, cough. He would be put on a steroid and his symptoms would improve for 3 to 7 days, but then he'd be right back where he started. All lab results were normal. So he goes to the dentist, a longtime family friend, for a regular cleaning checkup where they do the typical x-rays. He said after the x-rays, he did not see a staff member for at least 20 minutes, and that's when he knew something was up. Dentist came in, pulled up his x-ray, and started explaining it. My dad had a huge tumor. The body sat between his hard palate and sinus cavity, and it looked like an octopus the way it had arms that were wrapped around some of his jaw and teeth or roots of his teeth or whatever. Imagine my mom's and me and my siblings' shock when he came home and showed us after going for a dental cleaning. All in all, he obviously had the surgery to remove it. He lost part of his palate, all but 2 of his top row of teeth, and part of his jaw, but they got the whole tumor, which was benign, but they didn't want to leave any of it and take a chance of regrowth. It took like 3 months for him to be able to get impressions done for dentures. I say that loosely because it's a big contraption with a piece to fit the hole in his palate, plus extra support due to lack of jaw, along with the typical teeth, and an additional 1 to 2 years to get them to fit right, especially when eating drinking. He has a hole from his palate to his sinus cavity, so when they didn't fit right, food liquid would slip through and come out his nose. Cool party trick, but not fun. Now, 10 years later, you'd never know anything remotely close to that happened to him. Unless you're at our house at 10 p.m. when he takes his teeth out for the night. So can you turn the lights off downstairs? Sounds like lie off your air. It's pretty amazing how the stars align. Thankful the dentist caught it when he did. Thankful it wasn't cancerous, as he has thyroid cancer a few years previous to that. Thankful our dentist knew of a surgeon in our area willing to take down the beast, and that he did it well. Thankful that that doctor knew of a person that made specialized dentures mouth prosthesis in our area. The maker was 1 in 15 people in the USA that could make something like that, or some wild statistic. Thankful my dad perseverated, especially going from eating sandwiches, his favorite salads, steak crunchy stuff, to literally pureed crap for 4 months, then had to gradually work his way up after the dentures. I think it took 1.5 years before he was able to bite into a sandwich without pain, or his dentures slipping out of place or falling out completely. Story 5. I am one of those cases. I had a hysterectomy, and 7 weeks later, a random artery burst open through my newly sewed up female body part. I had started spotting out of nowhere, and my OB-GYN just happened to be in the office that day, so she told me to come in. As soon as I got to the office, the spotting turned into gushing and pumping. I lost 2 liters of blood on the office floor. She put me on the table and looked inside. Said she's never encountered this before. She could see the artery pump blood out with every heartbeat. She did emergency surgery right there, no meds. She saved my darn life, stopped the bleeding, and shipped me off to the hospital for meds. I had a parade of doctors coming in the next 2 days, looking inside me, wondering how the fudge and artery burst through my wall. Eta. My boyfriend was in the waiting room and heard the whole thing. He was certain I was going to die. This happened during a horrible time in my life, so thankfully I was already in trauma therapy. I definitely needed it after this experience. For those women that just had a hysterectomy and now have a new fear unlocked, I'm sorry, this situation was not normal. Even with the complication, I don't ever regret getting it done. Answer: this happened to my best friend, but she bled for weeks because it wasn't that much. Dr. Straight refused to even look at her, telling her it was just her period. The period he told her she couldn't have due to the procedure he gave her. She ended up in the ER after I screamed at her to go ASAP because she was cold and dizzy. She was well on her way to passing by the time she was seen and rushed into emergency surgery. I guess it just kept opening a little more every day until she was about to bleed out. Story 6. I'm not a doctor, but I work in an ER trauma center doing patient registration, which puts me up close and personal with a lot of gnarly shoot. Had a patient come in with a frozen leg. They were pissed off that their doctor wouldn't amputate a perfectly healthy leg, and so they submerged their entire right leg in dry ice for close to 7 hours to force a medical team to remove it. The leg was so solid it made a noise when the doctor knocked on it. I can't even imagine the pain this person withstood in order to get the leg cut off. It was a case of that rare mental condition in which your brain rejects the idea that your body parts are actually yours. Nobody in the hospital I work at had ever seen a case of it before. Answer: whoa. I was called to the ER to do a psych evaluation on a patient once. He was complaining of odd gastric symptoms and insisted that he needed to lose weight so that he would not die of cancer. He decided that the quickest way to get the weight off was to get a limb amputated. He eventually disclosed that he had shot himself in one of his legs in the hopes that it would become gangrenous and need to be removed. So he was sitting there with a poorly healed and poorly bandaged, self-inflicted GSW hidden underneath his clothing. Case in point about why we have to get patients medically cleared before transferring to psych services. Story 7. My ENT walked into the room on my first appointment and told me I had the weirdest CT scan he's ever seen. Does that count? My sinus cavity is like 85 fungus, apparently. He was genuinely surprised I could even breathe through my nose. The CT is kind of horrifying. He thinks it's been like that since I had jaw surgery 15 years ago. Once I have surgery to clean it out, I'm probably going to OD on oxygen. Answer: I'm 800 years old. I'm not sure how to actually post a photo in a comment, but here's an IMGOR link: fungusy sinus. According to the ENT, the circled areas are my sinus cavity, and they should be black on the CT scan, which is to say mostly empty. Also, he thinks that white chunk on the right is probably some bone from my jaw surgery that just got left behind. Story 8. Kid came in still unable to walk at 3 and with funny eye-rolling movements that look like they could be seizures but with normal EEG. This is called oculogeric crisis. Basically, the eyeballs keep getting stuck in an upward position. Genetic testing showed she had a rare defect in the enzymes that make dopamine and serotonin. The thing is, we use L-Dopa, which is the last precursor to making dopamine, in patients with Parkinson's disease. Her defect was in an earlier step in the process, and the enzyme that handles that last step was fine. We were able to treat her with L-Dopa and 5-HTP, the final precursor to serotonin. 6 months later, she was running. She'll have to stay on medicine for the rest of her life, but with meds, we could unlock her body for her. For D. Story 9. Obligatory not a doctor, but my cousin's baby is one of only a handful of recorded cases ever, around 25, of having a fully developed third nostril at birth. Story 10. I'm not a doctor. My dad was the patient. He had stage 4 non-small cell lung adenocarcinoma. We knew he had a short time. 5-year survival is about 10, but he had had bladder cancer in the past and also post-polio syndrome, so it was probably a couple of years at best. But he wanted treatment while there was some hope for it to work a bit. He and my mom had just bought a house in NZ, and he wanted to live there and enjoy the scenery for a bit before he died. So he starts chemo, and he got the usual chemo side effects, one of which is an itchy rash. Chemo rash was one of the things they warn you about, so it didn't bother him too much. He just put cream on it and didn't complain. Then my brother visited. He's training to be an EMT, so he had some basic medical training, and he looked at the rash and he said, "Dad, please come to the hospital with me." This was in 2022, so Dad would have been in the hospital by himself due to COVID limiting visitors. And he really didn't want to go. But my brother insisted over and over, and eventually Dad gave in just to get my brother off his case. Turned out it was not just chemo rash. It was the start of a rare disease called SJS, which in rarer cases can be brought on by allergic reactions. Rarer still for it to be brought on by allergy to chemo substances. Please don't look up SJS unless you have a strong stomach. He lived in the burns ward for a month or so while my mom was packing up the old house. Luckily, due to his prognosis, they let us all visit every day despite COVID. So yeah, my dad was allergic to chemo. He lasted another 2 months after the onset of the SJS. I miss him every day. He did get to live in the NZ house for 3 weeks. He probably shouldn't have flown. With his lungs in such a crazy bad way, flying was a bad idea. But he was going to live in that house if it's the last thing I do. And it was. We were all there with him when he died. Answer: I'm so sorry about your dad, but I'm so happy to hear that he was able to spend his last several weeks in the new house. My mom had rectal cancer. Treatment started with radiation therapy, which was supposed to be followed by surgery, but she refused the surgery because she didn't want a colostomy. They started chemo instead, and she had a serious reaction and couldn't complete it. The medical team assumed that she would then go for the surgery, but she wouldn't. Said she'd rather die than live with a colostomy. I was devastated, and we all tried to convince her to have the surgery, but she was adamant. The outlook was poor. That was in 2017. Apparently, the radiation therapy wiped out the tumor well enough that it never came back. She just turned 80 and is currently on a cruise in Alaska. She's a tough, stubborn old bird, and I love her so much and feel infinitely grateful that she's still with us. Story 11. Also not a doctor, but my friend was the 1 in a million case I was there for. We were in high school at the time, and she had been suffering from chronic back pain for years, but they couldn't figure out what was wrong. Finally, they discovered that she had a little cyst pressing up against her spine, so they were going to go in and drain it with a needle and see if that helped with the pain. Well, 1 MRI later, they discovered that her little spine-adjacent cyst was actually an ovarian cyst. The anatomically astute among you will note that the ovaries are nowhere near the spine. Usually, this cyst was near her spine now because it was the size of a watermelon. They had to do major surgery to remove it, and she missed most of the school year recovering. If I recall correctly, it ended up being documented in a medical journal. It was that unusual. She was an average weight girl with a little pooch she couldn't seem to get rid of beforehand. Afterwards, she weighed 10 less pounds and was slightly concave. It was so large it was displacing her other organs. The whole thing was crazy, but thankfully she made a full recovery, healthier than she was beforehand even. Answer: I had an ovarian cyst like this. When I presented to ER, because I had an ovarian torsion due to it, doctors came from all over the hospital to look at my scan because they had never seen anything like it before. All my organs had moved to make room for this cyst, and nothing was where it should have been. This was a major London hospital. I would have thought they'd seen a lot in their time. I was tiny, a UK size 6 with stomach as flat as a tack. I had no idea what was growing inside me. Story 12. Literally saw this with my own eyes. An ED nurse in Australia was in charge this particular evening when I was called to the trauma room. Sitting calmly on the side of the bed was a middle-aged Polynesian man with a broken pool cue through his head. On closer inspection, the tip had gone in through his right eye and pushed his eyeball up, but eye was still intact. You could feel the tip pressing against the skin in his occipital region, but no broken skin. Absolutely not a single drop of blood, and his GCS was 15. Only thing he couldn't remember was how it actually happened. At the time, I had a spare ambulance crew in the department, so they got on the phone to their comms saying there was an imminent transfer up the road to a tertiary hospital. Honestly, all we did was put an IVC in, gave him a shot of IV-ABE, and bundled him out within about 15 minutes. All the time sitting upright. His surgery took hours because the flattened Q-tip was in danger of clipping a blood vessel as it was being removed, the reverse way it went in. So every movement needed to be checked. His CT scans from there are apparently legendary. Turns out there is a 1 in a billion way of essentially pushing the brain upwards and missing every vessel a couple of days in hospital for IVABs, and he walked out with no adverse effects to brain or eyesight. Answer: had a similar incident when I was a resident in surgery in the ED. Kid comes in with a toy arrow, actually a dowel. He fell on while running, went in just medial to the left eye, about 18 inches sticking out, flailing around on the ambulance stretcher. First thing was to hold the kid's head and the rest of him, tightly for a few seconds and cut off all but 3 inches of arrow so he couldn't perform more of a prefrontal lobotomy than he already had, called neurosurgery, who was on his way immediately, and ophthalmology, who didn't want to come in because he was eating dinner. Survived, don't know his neurological or ophthalmic outcome. Story 13, obligatory. Not a doctor. At 3 years old, my kid had a total personality change, which for somewhat justifiable reasons, was blown off by doctors because three-nager is a term for a reason, LOL. But I knew it was different. I kept saying, no, this isn't that. For the next several years, random AF symptoms would pop up, then go away after several months. I must have taken my kid to every specialist in a 500-mile radius, LOL. The doctors started treating me like I had Munchausen by proxy. I also felt totally insane because symptoms would go away for new ones to emerge, like when you bring a car to a mechanic and now the engine isn't making that sound. I begged for tests and MRIs over and over. I was always told no. Why would I want to expose my kid to radiation? Edited to add, MRI doesn't have radiation, but I was told CT first to get to MRI, which she has had tons of MRIs now and will for the foreseeable future. By the time they found the brain tumor years later, we had something like 13 different psychological diagnoses. All turned out to be inaccurate. Luckily, it was a slow-growing brain tumor, and it is incredibly rare. Something like 100 people a year get the diagnosis. In excellent news, St. Jude is the most amazing place ever, and we are through treatment, neurosurgery, proton beam radiation, and a slew of meds, and life expectancy is solid. I cannot possibly say enough good things about St. Jude and our experience in their research program. Moral of the story, never not trust your gut instincts as a parent, ever. Answer. My uncle was leaving 65 of his money to St. Jude's when he died because his only daughter was taken care of by them for the 1 year she lived. His cunt of a wife, not that baby's mom, stole all his money. There's a whole court thing going on, but the money's already gone. Really disappointing. It was the one thing he really wanted to be done when he passed. Story 14. Hydatid cyst located in the brainstem of 8-year-old kid. The parasite itself is rare, and the location even rarer. Story 15. Not a doctor, but lab personnel. Had a case of a male patient being screened and sequenced for metastatic cancer. Results as ovarian primary. You read that right. Male, anatomically male, not transitioned. Males don't have ovaries. The pathologist had us repeat the test because clearly the lab made a mistake. The result was the same. Ovarian primary. Turns out this poor patient had a liver transplant and the female donor had undiagnosed, undiscovered ovarian cancer that had metastasized to the liver, which went wild when transplanted into the male patient who was on immunosuppressant substances. I believe a medical journal paper was submitted on the case as it was very bizarre. One of my most interesting cases to work on. Story 16. Had a patient present to the ED after a bee sting and a pretty bad reaction. We found a softball-sized tumor on workup sitting on her cervical spine. Would have been a quad within a year. That bee sting truly saved her quality of life. Answer. Had a similar story. We were at rugby practice and people were slacking off. So coach comes up to me and says, put a shoulder in next time someone comes at you soft. We were doing passing drills with some light defense. So this guy comes up and is totally not expecting any resistance. I put a shoulder in and hit him across the chest. He immediately collapses on the floor, trouble breathing. Well, he goes to the hospital to get x-rays and I cracked his sternum. But on the very edge of the image, they could see a little mass close to his pancreas that looked suspicious. Well, it was cancer. And because they caught it super early, he got surgery and was good to go. If I hadn't cracked his sternum, who knows when they would have found it. Story 17. The patient in this story went to the hospital for a kidney stone blocking the left side. While there, I get a kidney stone blocking the right side. Doctors thought I was pill seeking because I kept changing where the pain was, but I pushed for another scan that confirmed I had stones in both kidneys at the same time, and both kidneys were now blocked off. That's pretty rare, but not unheard of. That night, because clearly I pissed off some ancient deity or something, I had ovarian cysts explode on both ovaries. The doctors were shocked someone could have so much bad luck in such a tiny time frame. Math's 9 of women get kidney stones. Of that 9, only 10 get bilateral ever, and a far smaller number get bilateral at the same time. 10-ish of women will have an ovarian cyst. Of that 10, about 1 will have them rupture. 30 of women with cysts have multiple cysts at the same time. I don't know the data on how many women have multiple ruptures at once, but I'm assuming it's a small number of women. Someone who can do math will likely be able to figure out how vaguely 1 in a million I am. Answer: 9 get stones. Around 2 of those get them at the same time, 0.18. 10 of women get cysts. Of those, 30 have multiple. 3, 1 of them rupture. The odds of both rupturing, 11, 0.01, 0.003. Odds of both, 0.080, either 0 and 3. Around 1 in 185 million. This is a really basic calculation, just off the numbers though. Kidney stones are chronic conditions, so the math there is relatively accurate. Ovarian cysts, on the other hand, more complicated. The 1-1 calculation is based off individual lifetime risk of 2 cysts rupturing, which doesn't capture the odds accurately at all. The fact that you detected the kidney stones at the same time is just surveillance bias, not related here. Apparently, cyst rupture is tied to hormonal surges during a narrow window of the menstrual cycle. So if one cyst is primed to rupture, the other is too, but also the odds of reaching rupture threshold at the same time is quite small. So narrow window hormonal influences rupture threshold modifies the entire question. There's also not very much data on the synchronicity of these things, since it's more of a curiosity than an actual practical importance. So the guess is very rough. Probably more than 1 in a million, but less than 1 in 185. Story 18. I have intractable medication-resistant bilateral temporal lobe epilepsy. My epileptologist goes to conferences about my brain occasionally. I wish I was invited, LOL. Story 19. Creutzfeldt-Jakob disease almost a decade ago, nothing we could do within 2 weeks of presenting to the ED, the patient died. Going back, Neuro said spouse told him the patient was kind and gentle, always joking and sharp up until a few months before they showed up to the ED, everything changed. A full 180. Very sad. History included 1 episode of money brain ingestion years and years prior while they were on vacation. Edit update. People messaged me about symptoms and what I saw. As this is a rare disorder, I don't want to violate any HIPAA, so we'll be general. Wahid 6 to 9 weeks of personality changes. Increased sleepiness, cussing and swearing with anger of a normally calm and docile parent. The last 4 days before coming to the ED was sleep, yell, drink, water not adult beverage, then sleep. No real medical problems presented to ED. Sleeping comfortably in bed, HR hundreds, rest normal, pulse ox normal, BP high like really high sleeping, 20. Family sitting at bedside, crying and whispering. I walked in and said, "Hello, I'm doctor." Patient jumps up out of sleep, starts yelling nonsense and cussing. HR jumps to the 130s. BP shots up higher. Within 1 minute, he was back to sleep. And that same sequence of events happened every time we touched him or a loud noise occurred near or in his room. Blood work all normal. TSH. Substances screen. ETA. We thought it might be withdrawal from drinking secretly. We were just guessing. So we gave him Ativan, didn't really do much for his vitals, but did make him sleep more as we tested him. CTs with angio normal. Alt-P slightly up opening pressure, but he kept moving, so it was hard to get an accurate read, otherwise relatively normal. Admitted to floor with neuro for EEG. Neurologist called me the next day and says this is most likely CJD. Repeated 1 megahertz spikes over and over again, almost pathognomonic, but we will know more if he quickly decompensates over the next week. Patient went from walking in with family confused to intubated within 48 hours and dead in less than 2 weeks. It was devastating for that family. Such a great parent from what they were telling me and the stories they shared. Very sad. Answer: prion diseases are horrifying, but I am so fascinated by them. The weird thing is, it can also be hereditary. Imagine living your whole life wondering if that mutation is destined to kick off one day. I remember the mad cow outbreak in Britain during the 80s and being terrified. So being me, I read about it, being relieved that I was low risk since I didn't live in Britain, lol. I am now a surgical nurse educator now, and I do yearly teaching on prevention of contracting CJD via neurosurgery. Also, being from the Midwest, during hunting season, hunters have to be careful as there has been reports of deer with CWD. Story 20. Not a doctor, but I shocked the delivery ward. I was 18 and pretty healthy when I got pregnant the first time. Had placenta previa, which isn't rare but isn't ideal. It's where the placenta sits over the cervix, making natural birth near impossible. What was shocking was the 6 weeks of bleeding from 23 to 29 weeks, pretty much constantly soaking pads. They couldn't figure out the cause. And then there was a massive bleed that triggered labor at 29 weeks that led to an emergency C-section. I didn't see the placenta. I lost nearly 2 L of blood, but half the hospital did. Apparently, it was super discolored, almost black, and had chunks missing. They sent it away for testing, and I never did find out the cause, but went on to have 2 pretty normal, full-term pregnancies. I did have cholestasis the 3rd time. That's rare but not unheard of. And my son survived, perfectly healthy and somehow huge for his gestation at 3 pounds 12 ounces. He turns 10 on Monday. Story 21. Not a doctor, RN. One of my first cases, a woman with full body skin disease, cancer, head to toe. Her hair was gone, her eyelids gone. She looked like a burn victim, but it wasn't burns. It was so bad they had to keep air control going at all times so her skin would stay in the room. It was flaking off and flying about, and her skin was everywhere, in the halls, on clothing. She was miserable, and she finally died, which was a blessing. I think she should have been in the burn unit, but who am I to second guess that? She had some rare skin disease. Story 22. Really wild calf hard on necropsy. So this was a couple-week-old beef calf that had a single day of difficulty breathing out in pasture. The farmer gave a dose of antibiotics, but the calf died shortly after. He'd otherwise been moving with the herd normally and doing normal calf things. We're expecting pneumonia. Instead, we open the heart and there's pretty much just one ventricle. By that I mean there's a double outflow right ventricle, so both the aorta and the pulmonic trunk are coming off of the right ventricle, with a common atrioventricular valve connecting to both left and right atria, this tiny little flap of left ventricle, and a ventricular septal defect. The right ventricular wall is really thick and the atria are dilated. So for those non-medical folks in the crowd, the normal mammalian heart has 4 chambers. Blood enters in the right atrium, goes through the right AV valve into the right ventricle, then out the pulmonary artery into the lungs, back into the left atrium through its own left AV valve, into the left ventricle and out the aorta. In this case, the blood is going RA to RV to lung, back to LA, then RV, then body. That's not good, but apparently it's good enough to make it a couple weeks. I had a cat a few years later that was less severe, separate AV valves that regurged less, and a large VSD to send blood back to the right side, who made it to a couple of years old. That's actually kind of sort of how a reptile heart works. Like they have 3 chambers, but the reptiles have all sorts of grooves and nubbins to take advantage of laminar flow and separate out oxygenated from deoxygenated blood that way. They've also got a far lower metabolic rate and oxygen demand compared to a mammal. But yeah, cow with a reptile heart. Answer: I've got something similar. L-transposition of the great arteries. Blood flow when I was born went right atria, left ventricle lungs, left atria, right ventricle body. I also had VSD and pulmonary valve atresia. So since my pulmonary valve wasn't functional, the blood flow skipped my lungs and basically just went through the heart and back out without oxygenating. Lots of surgeries to fix, but I love my patchwork heart and funky medical conditions. No issues with it nowadays. Just need yearly checkups to make sure everything is still functioning. Story 23. My father at 53 had a full aortic dissection ascending type A. That thing that eliminate John Ritter. He walked himself into the ER, gut swelling from blood being dumped from his heart, blood pressure 43, did 14 hours open heart surgery with a full mechanical valve replacement and pacemaker dependent. He turns 60 next month. Oh, and his sister died from the same thing at 53. Miraculous he lived, stranger, still 2 siblings had the same condition. He is part of lots of studies. Story 24. I was the doctor's assistant at the time. I worked for an optometrist who mostly just did general stuff, eyeglass prescriptions, pink eye treatment, nothing too crazy. The weirdest one was the young man who went swimming in a lake with his contacts in, and they trapped an amoeba between the contact and his eye. So the amoeba burrowed into the inner part of his eye. He came in thinking he just had a nasty infection. And wow, that was an upsetting diagnosis. We immediately sent him to a specialist in Denver. Story 25. Not a doctor, but I do have a pretty weird, super rare skin condition called linear atrophoderma of Mulan. It just kind of showed up one day. Looks like a spiraling line of bruises. There are less than 50 documented cases of it in reported literature. Story 26. Backstory: Dad ran a NICU, very well respected in neonatology, currently runs it for the state as well as a related charity. As a result, growing up, I was in there a lot because I had to stay home from school, or they couldn't get childcare. So all the staff knew me, and the occasional times there was some sort of media involvement, I got dragged along. Actually kind of cool going to fancy charity gliss balls as like a 19-year-old. Story: baby born very premature, severe complications, basically DOA. Masseuse attempted, failed. Dad declared baby dead, like Yep, that's done. Game over. Sorry, ma'am. Now, part of the process with stillbirths or deaths very soon after birth is to give the body to the mother to hold. It's shown to be an important part of the grieving and healing process so that she can get closure, and I hope none of you ever have to experience it. The mother is given a warning that for quite some time after passing, the baby can spasm. It's this weird evolutionary thing where the brain fires off signals trying to revive the body. They're warned because when it happens, a lot of mothers will think there's a chance or the baby isn't really dead, but the doctors reassure them that it's just this weird evolutionary thing we never got rid of, like our tailbones. The baby isn't alive. The mother is just looking for hope where there is none. So mother gets the baby, holding it, crying, husband there, stoically, being a rock for her. Well, she starts freaking out, saying the baby's alive, yelling for help. Of course, staff come by explaining that no, baby is dead. We told you this. Mother insists, dad takes a look. And that's how I wound up an 8-year-old at a huge press conference beside my dad, who was talking about something that only one other living doctor had ever seen happen. Baby Lazarus, yes, that's what they actually named him, had come back to life because of this weird evolutionary hang-up. Story 27. Not a doctor yet, but during my summer break, as a medical student, I have to do something called summer practice in my country. Keep in mind, I choose to do it in my small-town hospital, not in the hospital where my university is. One evening, the doctor I was with decided to do a CT for a patient, and it turned out he had situs inversus. Basically, all his organs are in the opposite part. Liver to the left, heart to the right, etc. One person from 10,000 present this condition. Answer: I have a family member with this. They were in an accident a few years back, and it ended up saving their life. BC, had the heart been on the correct side, they would have died in the accident. I remember everyone having to announce it to the new doctor or nurse that would appear. They had a long hospital stay after said accident to recover, and the nurses ended up writing it on that little whiteboard in the room so everyone knew. Story 28. Not a doctor, but my mom was the patient. Starting from 6 weeks old, she has had a wild medical ride. She almost died as a newborn because she had a blockage in her intestines that statistically mostly happened in males, so her doctors almost missed it. She lost a couple pounds as an infant before they figured out what was wrong and got her into surgery. That started her journey, but definitely didn't end it. She had cervical cancer in her early 20s, but that's not too unusual. She had a hysterectomy after my younger sister was born because the cancer cells just kept coming back. She had her gallbladder removed in her early 30s and had chronic headaches, pain, and a weak immune system, partially from having part of her intestines removed as an infant her whole life. But in her 40s, the headaches just kept getting worse and worse, and she pretty much refused to see a doctor. She also started making really rash, out-of-character decisions and started acting differently. It was a wild time for a couple of years with her and my dad, both breaking up and getting back together multiple times. Shortly after my 18th birthday, her headaches became much worse. She couldn't move, couldn't stand light, could barely speak without it hurting. She was leaking a clear, metallic tasting fluid, her words, out of her nose. We finally convinced her to go to the doctor. Turns out she had contracted bacterial meningitis. She was in the hospital for 2 weeks. While there, after getting MRIs done, they realized she had a tumor in her sinus cavity. She was referred to an ENT who freaked us all the fudge out when she looked up my mom's nose, said, "What the hell?" and went to get the other doctors in the practice to also look. Apparently, you could see the tumor from her nasal cavity, but that's not all. After more investigation, they realized the tumor had actually started in her brain, ate through her skull into her sinus cavity, and had been growing for years by that point. She had 2 surgeries. The first through her nose to get the tumor there, so she could breathe easier, and the second into her skull to remove all of it and patch the hole in her skull. The fluid she was leaking was cerebral spinal fluid. She got meningitis because of the hole in her skull after she suffered a bad sinus infection earlier that year. The tumor in her brain was pressed up against the region that controls impulse control and decision-making, and explained why she made some batshit decisions. They might not have caught the tumor in time to save her if she hadn't contracted meningitis. She also stopped smoking after she had meningitis because she was in the hospital for so long. She figured why not. And after all that, when they sent the tumor off to be tested to see if it was cancerous, they said it was composed of brain-like material and had no explanation for why she got it, but it wasn't malignant. She's good now, more than a decade later. She had seizures for a while after the surgery, but we realized a couple years ago they were triggered by stress and anxiety. After therapy, medicine, and a whole lot of work on her part, she hasn't had a seizure in over a year, when she had them almost daily to begin with. Pretty wild ride if you ask me, and one I hadn't heard before or since. Story 29. Obligatory, not a doctor, but my pregnancy with my daughter was one. I was 21 weeks and 3 days pregnant with fluid discharge and Braxton Hicks. I ended up going to the ER alone after I saw a small amount of blood in the fluid. I get taken back to LD in a wheelchair just in case where the monitor contractions and tested the fluid. Turns out it was amniotic fluid, and I was in active labor for hours. They looked in my female body part and thought they saw her head in the birth canal. I was told there was nothing they could do, and I would give birth to her, and she would pass naturally since she was too early for intervention. Eventually, an obgyn and ultrasound come in, and it turns out that the inner layer of the amniotic sac was intact, and it was her feet in the canal. I had a 15 placental abruption as well because of the weight pulling down. I asked if there was anything that could possibly be done to save her, and they eventually transferred me to another hospital with an MFM doctor. I was truncated and put on all the things to stop labor. I ended up getting super lucky because she was one of the few doctors in the country that would even attempt to save the pregnancy. I had an emergency rescue cerclage where they washed off the sac, eased it back in, and sewed me shut. I ended up in PNU and was inpatient for 8 weeks, where by some crazy luck, I managed to stay pregnant. I was in a ton of meds to stop labor around the clock since I kept having a ton of contractions. I wasn't allowed to sit, stand, use the restroom or anything it sucked jerk, but I had a few rounds of steroids for her lungs, magnesium to protect her brain. I was so lucky. Eventually, at 29 weeks on the dot, I ended up with an urgent C-section because my uterus had an 8 cm pericardial window and was about to rupture. It was also harder and harder to keep the contractions at bay. She is now 8 years old, super smart, gregarious, and an amazing athlete. I could not imagine a world without my daughter in it. Over 95 of cases like mine end up in fetal and/or maternal passing. I just got the luck of the draw that the right doctor was there, and everything went right just in time. I did end up with a hysterectomy a couple years later after it fused to my abdominal wall. It was too dangerous to risk getting pregnant again. I have my son and my girl and count myself lucky as hell. Story 30. Not a doctor. My friend was recently in the hospital for over a week with high fever, trouble breathing, fatigue, lots of weird symptoms. They thought flu, COVID, pneumonia, bronchitis, tested for everything, and it didn't match anything. They then found out he's a landscaper, so started evaluating for dirt-borne illnesses. They believe from the scans he was infected a long time ago, as his lungs look so bad. He works with a crew and no one else had any symptoms. They narrowed it down to some sort of fungal infection, likely from animal droppings. They thought maybe histoplasmosis, blastomycosis, hantavirus, something like that, but haven't determined anything for sure. None of these are common at all in our area. They want to continue evaluating him, so asked him to come in for free appointments as a test subject. Story 31. I've seen a couple of cases of stiff person syndrome, which has an incidence of around 1 in 1,000,000. Although these people already had their diagnosis, so I can't claim credit. Story 32. Not a doctor, but am the 1 in a million, probably less. I was diagnosed with osteogenesis imperfecta as a child, 1 in 15,000 people. No big deal. I have a mild form, and it hasn't impacted me much other than blue sclera and frequent fractures. A year ago, I found out during a checkup that I had a 5 cm aortic root aneurysm that needed immediate surgery. I had a valve-sparing repair a week later. All is well. Turns out, in one of the very few people whose osteogenesis imperfecta present itself with Marfan vascular Ehlers-Danlos symptoms, which affect the cardiovascular system. I have since been tested to check I don't have 2 separate mutations, one that would cause OI and one for Marfan's or ED, but I don't. Currently, there's only a handful of cases in the literature of people with this OI-ED overlap syndrome, and even fewer with a recorded aneurysm. So I think the maths works out to much less than 1 in a million. Story 33. Women with mass in lower abdomen on scans. She says she has been having menses regularly. Exploratory surgery performed. It turns out very enlarged uterus. Gynecologist nips the uterus, and suddenly a huge amount of chocolate-looking thick fluid fills up her whole abdominal cavity. It was old menstrual blood under pressure that has been collecting who knows for how long. Probably all her childbearing age if it was congenital. Testing showed that it was sterile, no infection risk due to the spill, but risk of strictures around guts and other peritoneal organs is there. Gynecologist probes the cervix, it's totally closed, i.e., no way she has been having regular periods. Turns out she lied out of fear of her husband. She didn't want her husband to find out because one of her presenting complaints was also inability to conceive for long time trying. It was in a third world country where this is a big deal in society. Story 34. I was the patient, and the actual ER doctors missed it twice because she's too young at 22 for a pulmonary embolism. Except I was 6 months postpartum, on birth control, had recently had pneumonia, and also had a family history of CVA and MI related to blood clots. I was so high risk, I was basically a DVT waiting to happen. Thank all of the gods for putting a PA who was fresh out of school and eager to prove himself into my path. He talked the doctor into ordering a CT with contrast, and they found a clot the size of a golf ball in my left lung. The doctor was ready to discharge me, and I likely would have died if not for that PA who trusted their gut and probably took a ration of shoot from his colleagues until he was proven correct. He knew that something wasn't adding up to simple pleurisy and saved my life by trusting his instincts. Answer: this also happened to me in my mid-20s. I was put on birth control about 4 weeks prior and did a transatlantic flight. My GP missed it, dismissed my knee pain as an injury because he did hip-to-ankle ultrasounds on both legs as soon as I got back from my trip to be safe. Clot was behind my knee, PT broke it up and sent 5 chunks into my lungs. First ER doc dismissed me as having an asthma attack. Second ER doc 2 days later asked me if I had leg pain, got an instant CT. Infuriating. Ultrasound tech who found the giant clot from knee to thigh told me I should go buy a lottery ticket. Story 35. Not a doctor, but a former legal guardian. In the mid-90s, I was assigned to a guy with AIDS. Last stadium, melanomes and all. He was in a hospital at the time. The doctors gave him 3 months max. So I found a special hospice, excellent place, and drove him there some 5 hours away. On arrival, the director said it's a matter of weeks, maybe a month. The guy fully recovered, the guardianship was lifted, and he lived a happy and crazy life for years to come. Story 36. I have a male friend who was diagnosed with breast cancer in his early 30s. He kept getting pissed when doctors would tell him how rare it was. Answer: my uncle died of breast cancer. It may not be nearly as common in men, but given how it's more rare and apparently often diagnosed later and not as responsive to treatments that work for women, we need to talk about this more for men. Monthly breast screenings are for everyone. Especially if you're trans or NB and doing hormones BC, the data is not there yet for y'all. General male breast cancer, trans folks risks. Edit, fixed link. Story 37. Not a doctor, my mom was the patient. She had breast cancer that metastasized into her bones. One night she was in immense pain and was taken by ambulance to the ER. Turns out the cancer had eaten away a section of her spine, basically disintegrating a part of it. She was told that she likely would only survive a few more weeks. Instead, she survived another year and learned to walk again. Mind you, she was now hunched and at least 6 inches shorter because her spine was basically compressed down. But she was able to be mobile, walk, and live a fairly normally life for a bit until the cancer spread to her brain. Story 38. I am not a doctor, but my Nana was the patient. She defied the laws of reality and modern medicine several times. Got on dialysis at 79 for kidney failure. After 2 years of dialysis, her kidneys were fine and functioned normally, so they took her off dialysis. That doesn't happen. She lived for another 10 years and her kidneys weren't what took her out. Age 80, she broke her leg up by her hip. She was asthmatic and diabetic, and docs weren't optimistic about the risks of anesthesia, but they needed to fix her broken leg. They told us she probably wouldn't walk again. 7 months later, she walked my nephew down the aisle at his wedding without a cane or a walker to help her. Self-managed her diabetes for decades. Didn't take insulin. Ate basically nothing but sugar. She was fine. Got COVID at age 87, still asthmatic. It's a mild case and she recovers flawlessly. Shortly before she died, the doctor swore she couldn't swallow and had her on a liquid-only diet. Turns out she just didn't want to eat their nasty hospital food and was pretending very plausibly that she couldn't. Doctors were floored when they came upon the two of us happily munching on Del Taco French fries. Declared infertile after years of trying, adopts a baby, suddenly can't stop getting pregnant. Within 3 years, she went from being infertile to having 4 children under the age of 4. I miss my crazy medical miracle of a grandmother every single day. God bless her and her 9 lives. Answer: oh, this reminds me of my favorite aunt. She had rheumatic fever as a kid and later had one of the first pediatric open heart surgeries performed in our state. She later contracted polio in her teens while she was in the hospital with a broken arm. Survived polio, but lost most use of the right side of her body. Had to relearn how to write left-handed, and eventually, after years with braces, was able to walk unaided. She then went through college, moved out of state, married, had 2 kids, and eventually lost her husband to hepatitis he contracted through a blood transfusion. Once widowed, she and her now teen kids moved back to her home state to take care of her elderly mom. Soon after, she contracted Legionnaire's disease, which she recovered from. Then her house burned down. Few years later, she broke her femur and wrist in a car accident. Again, she recovered. Was diagnosed with lung cancer in her 60s and refused treatment. Managed to catch COVID 3 times, now in her 80s, and recovered from those. She died at 83 of heart failure and managed to outlive 3 of her healthy siblings. Through all of it, she never slowed down. Always the most fun. Always up for anything. Tough old bird. Story 39. I'm not a doctor, but I did diagnose a rare disorder. Starting in his teen years, my friend started getting what he called spells, where his hand and feet would twist up all weird. It would last for a few minutes, then go away. Doctors told him it was psychosomatic and put him in counseling. I met him several years later when he was in his early 20s. I was in grad school at the time and had taken a class on neurological disorders. I saw those spells and thought, that looks like chorea or athetosis. He finally went and saw an actual neurologist. Bam! Got diagnosed with a very rare choreathetosis disorder. It was very well controlled with a seizure medication and went away in his 30s. Story 40. It's nothing sexy, but as a head and neck surgeon, I frequently come across various cancers where there are only a handful of case reports about. Story 41. I'm kind of that case. My doctor threw a Hail Mary to prevent knee replacement, and it worked. He uses 3 injections of face filler, Gelson, to build a donut to hold up my kneecap. I have to have it redone every 6 months. I'd prefer 4, but it alleviates 75 of the issues. Insurance had already authorized a replacement, and I was already booked on his surgery schedule when he decided to try this. So when I say Hail Mary, that's even what he calls it. When I told him it worked, his face looked like I told him unicorns and pigs were flying around outside. He made me repeat that it worked 3x before his brain grasped it. Then he started asking really specific details, left the room and grabbed 2 PAs and another surgeon that he brought back to ask even more questions. Not exactly 1 in a million, but definitely a very, very, very long shot that worked. Story 42. My husband's gallbladder exploded, and the surgeon was wildly excited to discover that he had an extra bile duct. The words 1 in more than a million were used. Story 43. Obligatory, not a doctor, but post. My sew came down with epiglottitis about 5 years ago. She was diagnosed in the ER at a training hospital. It's rare enough that during the week she was in ICU, the hospital had every doctor, resident, nurse, and medical student they could come see her because they might never see another case. My aunt was an ER nurse for 30 years. And she never saw a case of it until my SO came down with it. Answer. That's an incredible story, and it must have been a terrifying time for both you and your SO. Thank you for sharing it. It's fascinating and a bit scary to hear how a condition can be so rare that it becomes a major learning event for an entire hospital. That really drives home the 1 in a million nature of it. I hope she made a complete recovery. Story 44. Not a doctor, but I had the weird condition. My eyes started hurting, progressively getting worse over a couple of days. My vision also started to blur in that eye. I went to urgent care, where he gave me a dilating drop, thinking it was something like uveitis, inflammation of the iris middle part of the eye. He told me to follow up with an ophthalmologist as soon as possible. I got in to see a neutral ophthalmologist the next day, maybe 2 days later. She thought it was optic neuritis, inflammation of optic nerve, based on what she saw in the head MRI she ordered. She gave me steroids and had me check back with her a week or so later. The steroids helped with the inflammation in my eye and around my optic nerve, but she noticed something weird on my retina and sent me to a retina specialist the next morning. He had some scans done and figured out that it was an infection of shingles on my retina. That same day, he took a tissue sample from my retina with a needle, yes, very unpleasant, and gave me an injection of antiviral substances, again, also with a needle and very unpleasant. I had to get about 5 more injections into my retina over the next couple of weeks. Now, about 2 years later, I've probably had 20 appointments with him, and my vision in that eye is degraded pretty significantly from 2015 to 2045 and with a few holes. But it still works, and it didn't spread to my other eye. Also even more rare to happen to someone at 29 instead of in their 60s, 70s. I believe the odds for me were something like 1 in 2.5 million or so. Story 45. Not a doctor, but my sister had an enormous tumor on her kidney in her early to mid-20s, and the doctors were so astounded that a bunch of them would pop in during exams prior to her surgery because the type and size of the tumor was rarely seen in people her age. Plus, it was only attached by a narrow trunk, which was a relief since they only had to remove 10 of her kidney to remove the tumor. My sibling and I, not my sister, also have a rare bleeding disorder that doesn't occur on either our paternal or maternal sides of the family, and the hematologist wanted us to get a genetics test for it because he was so astounded by it. Story 46. Not a doctor, but my kid is the one in a million. Routine annual wellness checkup for my 11-year-old turned up a solid, immobile mass in the left side in the supraclavicular area of the neck. For those of you not in the know, with this finding, it's basically a 1 in 3 chance of it being cancer. The pediatrician did a whole rundown to start: ultrasound, chest x-ray, loads of blood work, etc. The only abnormality was an enlarged lymph node in the area found in ultrasound. Because of the location of the lymph node, the size, density, and the inability to find another cause for it, our pediatrician referred us to a pediatric general surgeon to consult for a biopsy. We meet with the general surgeon, and after asking a few questions and doing an exam, he steps out to consult with a colleague. He comes back a few minutes later, asked if we can wait 25 minutes because the hematologist, the oncologist kind of doctor, wants to drive over to exam kid in person. So, yeah, we wait about a half hour while he gets to the office. He does a quick exam and basically says, "We're going to get more blood work and do a CT scan today." Luckily, the office is on the same campus as the Children's Hospital, so he calls radiology, orders a head, neck, and abdomen CT with and without contrast, and we head to radiology. Based on the urgency of the test, in some private conversations, this was basically trying to find out how extensive and grade the cancer. At this point, both doctors were ready to diagnose based on physical exam, in previous imaging, and tests, but they were being absolutely responsible in confirming their suspicions first. After the CT scan, we go back to the office and meet with the two doctors, who are absolutely giddy. First thing out of their mouths is that it's not cancer. Yay! Kid has cervical ribs. Kid has rib bones in their neck, not just on one side, but bilateral, both sides. And not only do they have bilateral cervical ribs, they have a bone spur on the left side in the supraclavicular region. Less than 1% of the population of the world has cervical ribs. Even fewer have bilateral ribs. And my kid has bilateral ribs with a bone spur in the exact location to mimic cancer. The pediatric specialist believed that the ultrasound misdiagnosed an enlarged lymph node because there was nothing to indicate it on the CT scan. Story 47. My wife had an ovary cyst as well a couple years ago. Had to remove the ovary and the 12-beat melon. The before and after pictures of her organs shifting was crazy. Her doctor had never seen anything like that before. Story 48. Not a doctor, but one of my friends had a ping-pong-sized brain tumor age 17. Doctors always told her she had migraine. It was discovered by sheer luck because she had an accident and they scanned her head. Surgery was life-threatening, but she lives to tell the tale. Story 49. Mine was so rare they did a case study about it. I was perfectly healthy, no prior medical conditions, no issues with my period uterus. I was pregnant and had a healthy pregnancy. I labored for 28 hours and then had to do a C-section. They opened me up on the table and said, "Oh shoot, there's blood in her cath bag." Come to find out that the reason why was BC, my son, wasn't coming down my birth canal because he was literally coming through my uterus and ruptured it. When this happens, we only have a few minutes to live. My doctors saved our lives and we are both perfectly healthy. At my follow-up, I told my midwife I labored in the hospital, otherwise I'd be dead, and she was so shocked. She said that everyone from the practice, which is about 45 years old, was called into a meeting for a case study. It was mine. In all those years and all those doctors, they had never had a patient have one. I am so thankful for medicine, providers, and now the practice has experience and can help other women that might be in my situation. Story 50. My dad. He rode his bicycle everywhere when I was a kid. He would ride it from Philly to Atlantic City and back. The man was a beast. He was also undiagnosed ADHD and lacked awareness of his surroundings. Many accidents later, he was routinely seeing a chiropractor. This doctor was God's gift as far as my dad was concerned. One night he came home after, and at first he seemed normal, and then he started vomiting. He was incredibly ill. My mom called the chiropractor, and they had him come back in. They adjusted his neck again. So now the small bleed that was happening became a massive bleed. He didn't go to the hospital until the next day. He was bleeding into his brain. It's a miracle he survived. He spent 2 months in the hospital. They had to take an artery from his leg to replace the one in his neck. Many papers and studies done won him. And this was the late 80s. I was 7-ish. I'm 43 now. He's 72. Still a walking, talking miracle. Don't go to a chiropractor. Even if you survive a brain-altering incident, it doesn't mean you will ever be the same. Story 51. 1100K, not 1 million, but malignant hyperthermia. Rare reaction to certain anesthetic substances that we are drilled in how to recognize and treat quickly, as it can be fatal unless promptly addressed. You generally go a full career without ever seeing it happen, much less being your own case. Had it happened to one of my elective cosmetic cases at the end of my first year of practice after fellowship, just after taking my oral board examinations. Story 52. Not a doctor, but my dad is a doctor, and my mom was a case that no one could figure out. At 36, she woke up in the middle of the night and wasn't able to breathe. My dad rushed her to the hospital where all of her organs started to fail, but no one could figure out why. Since my dad was a doctor at this hospital, a bunch of his doctor friends from every specialty came in the middle of the night to try to help. They couldn't save her. She was a perfectly healthy 36-year-old mother to 3 girls who that day had been hanging out laughing with her children. People thought my dad poisoned her or something. The police even investigated him. They sent her blood to the CDC and it came back as Coxsackie B virus, hand, foot, and mouth disease, super common in kids and treated with over-the-counter meds, but rarely seen in anyone over age 5. I didn't have it, and neither did any of the other kids. No idea where it came from, but it eliminated her in a couple of hours. Ruined my dad, whose whole identity was being a doctor and saving lives, and he couldn't save the life of his most important person. Story 53. Of course, not a doctor my kid was found to have seizures. Did the EEGs, and it turns out he's got a rare developmental epilepsy that primarily presents in sleep. It's 0.5 of all pediatric epilepsy cases. There's less than 200 cases in our whole country. Then we did gene testing and found that he's got a genetic mutation with less than 300 people identified worldwide.